Well, we have Dr. Madhusudhan Agarwal. He's coming from Agra. He's practicing in Agra actually. Well, sir, we'd be asking you very simple question about kidney stone management for our viewers for a better understanding. The very first and very simple question would be, why do you think the number of kidney stone cases are on the higher rise these days?
Yeah, of course. So in many of my public talks, I keep saying the same thing. But I think it's largely because of the dietary habits and lifestyle. So if you follow the simple rules of healthy diet, drink a lot of water, then you stay healthy. But if your diet is faulty, if you are taking too much carbohydrates or too much junk food, and most importantly, I think it's this habit of tobacco and pan masala which has become all prevalent, which has contributed to increase in the stone incidence, especially in India.
Right. Well, what has been the most challenging case of kidney stone that you have ever dealt with?
Well, there have
Anyone you can
been
recall?
many challenges. So we started doing
Yeah.
percutaneous surgery, the keyhole surgery for kidney stones, uh, almost 30, 40 years ago. I think we'll have to take a break in that.
Yeah. Okay.
दोबारा से शुरू करो
Patch.
वाला portion. Yes. We started treating kidney stones with keyhole surgery, which is called percutaneous surgery or PCNL, uh, some in the late 80s and 90s when the technology was just evolving. And over the years, we've managed to do some really, really challenging patients cases where the kidneys were damaged, the kidneys were full of stones, and the patients were given up, told that they cannot undergo surgery, not fit for operation. And most of these patients have done well after surgery.
Wow, wonderful. Well, in your experience, what precaution can effectively be taken by patients to avoid getting kidney stones, and if they have ever had it, not to getting the recurrent stones? What will you say on that matter?
So I think this is a good question because once somebody develops a stone, there is a very high risk. It is believed that almost 50% people will develop a stone within the next 5 years again. So it is very important. It's very important to take precautions and to prevent recurrence. And this is called secondary prevention. So first thing is drink a lot of water. Second thing is avoid those things which are rich in oxalate and calcium in your diet. So there is a list of dietary restrictions which somebody has to follow. And contrary to popular belief, you don't have to stop milk or milk products completely. Everything has to be taken in moderation. And another thing is there is no harm in taking tomato, but somehow a lot of people believe that tomato should be avoided. This is not true. And similarly, the food or the vegetables with seeds have nothing to do with stone. So there is no need to avoid them. There is a set list of precautions, the dietary restrictions, which are told to the patient. And the third and the most important thing is there are some medications which have to be continued long term to prevent recurrence.
Well, according to you, what are the greatest misconceptions that you think people have about kidney stones?
So one I have just mentioned.
Myths.
That the dietary restrictions which
Yes.
are listed are all wrong. And
There are people who say that you should not eat tomatoes, you should have beer,
yes.
you should have this and that.
Yeah, so this is, people stop milk, which is not true.
Okay.
People stop tomato, which is not true.
Okay.
People take beer, which is not true. So the most important principle is to drink a lot of water.
Yes.
To keep flushing your kidneys. And there are some medicines, and one of the medicines which is very popular is potassium citrate solution, which prevents stone formation. So that's one thing about the stones. The second thing is about the alternative or the indigenous therapies, Ayurvedic, homeopathic, ये जड़ी बूटियाँ, पत्थर चटा. Now, none of this actually works in any stone which is big. They only work for small stones which would pass out anyway if you just drink a lot of water.
Okay, that's the case actually. What do you think that this is going to be the next breakthrough when it comes to kidney stone management?
See, we are working on a lot of cutting edge technologies in kidney stone management, and we have lasers in new forms. We have the keyhole surgeries, the endoscopies, lithotripsy, and there is a lot of new advancement coming up in development of the equipment as well as the technology in managing stones and getting rid of the stones in a painless and quick manner. Okay. So there's a lot of progress being made, and the good thing is that we are part of this development. We have devised a lot of things, we have innovated, and India is one of the leaders in management of stones.
Wonderful. Well, what are your go-to kidney stone management when it comes to the patients? Go-to management solutions?
Coal. You want to?
The go-to management solution when a patient is there. So, what is the first thing you ask or first thing you do?
Okay.
Yeah.
So the sequence would be, first of all, find out what is the problem, get the proper tests done to evaluate, and then plan the treatment.
Plan the treatment. Well, that was very wonderful to have you with us. Thank you so much. Also, I wanted to ask you one very simple yet very important thing. How a patient gets to understand that he might be having a stone? What are the symptoms that he can think about?
See, that's the first thing. So, if you have severe pain in abdomen, especially in the flank on one side, if you have any burning in urine, if you have blood in urine associated with vomiting, sometimes fever, these are the usual symptoms that the people develop, and the pain of stone can be excruciating. Even a small stone. There is a saying that small dogs bark loudest. So even a small stone can cause severe pain.
Okay.
And once you consult a doctor, and this could be your primary care physician, he or she would quickly be able to understand that this looks like a stone pain.
And then the diagnosis.
And then they get the test done.
Okay. Thank you so much, sir. Very glad to have you. Thank you so much for answering all the questions.
Thank you. Thank you.